World Mental Health Day, October 10. Kindly note that this is an awareness video only. The viewers are advised to verify the contents before using them for any other purpose. World Mental Health Day is observed on 10th October every year with the overall objectives of raising awareness of mental health issues around the world and mobilizing efforts in support of mental health. There is no health without mental health. The day provides an opportunity for all stakeholders working on mental health issues to talk about their work and what more needs to be done to make mental health care a reality for people worldwide. Good mental health is related to mental and psychological well-being. Around 1 in 5 of the world's children and adolescents have a mental disorder. Depression is one of the leading causes of disability, affecting 264 million people. About half of mental disorders begin before the age of 14. People with severe mental disorders die 10 to 20 years earlier than the general population. Global economy loses around $1 trillion per year due to depression and anxiety. Mental disorders comprise a broad range of problems with different symptoms. However, they are generally characterized by some combination of abnormal thoughts, emotions, behavior, and relationship with others. Examples are schizophrenia, depression, intellectual disabilities, and disorders due to drug abuse. Most of these disorders can be successfully treated. Depression. It is characterized by persistent sadness and a lack of interest or pleasure in previously rewarding or enjoyable activities. It can also disturb sleep and appetite. Tiredness and poor concentration are common. The causes of depression include complex interactions between social, psychological, and biological factors. Life events such as childhood adversity, loss, and unemployment contribute to and may catalyze the development of depression. Schizophrenia is characterized by distortions in thinking, perception, emotions, language, sense of self, and behavior. Common experiences include hallucinations, that is, hearing voices or seeing things that are not there, and delusions, that is, fixed and false beliefs. Schizophrenia is treatable, and treatment with medicines and psychosocial support is effective. An estimated 76 to 85% of people in low and middle income countries suffering from mental disorders lack access to the treatment they need. Quality mental health systems must be accessible by all. Much can be done to help build mental resilience from an early age, to help prevent mental distress and illness among adolescents and young adults, and to manage and recover from mental illness. Suicide. Some patients with mental illness resort to suicide. Every 40 seconds, someone loses their life to suicide. For each suicide, there are more than 20 suicide attempts. Suicides and suicide attempts have a ripple effect that impacts on families, friends, colleagues, communities, and societies. Suicides are preventable. Much can be done to prevent suicide at individual, community, and national levels. If you are despairing, that you contact a crisis center. Many people have found that talking helps to alleviate painful suicidal thoughts and feelings. While the link between suicide and mental disorders, in particular depression and alcohol use disorders, is well established in high income countries, many suicides happen impulsively in moments of crisis, with a breakdown in the ability to deal with life stresses such as financial problems, a relationship breakup, or chronic pain and illness. In addition, experiencing conflict, disaster, violence, abuse, or loss and a sense of isolation are strongly associated with suicidal behavior. The strongest risk factor for suicide is a previous suicide attempt. Prevention and control. Suicides are preventable. There are a number of measures that can be taken at population, subpopulation, and individual levels to prevent suicide and suicide attempts. These include, for national responses to be effective, a comprehensive multi-sectoral suicide prevention strategy is needed. Reducing access to the means of suicide like pesticides, firearms, certain medications. Reporting by media in a responsible way. School-based interventions. Introducing alcohol policies to reduce the harmful use of alcohol. Early identification, treatment, and care of people with mental and substance use disorders, chronic pain, and acute emotional distress. Training of non-specialized health workers in the assessment and management of suicidal behavior. Follow-up care for people who attempted suicide and provision of community support. If any of your friends or relatives exhibit such symptoms of mental illness, kindly arrange necessary medical treatment and psychological support until they recover and become normal. Never ever discriminate them and treat them with dignity. If you like this video and want to view more such useful videos, kindly subscribe to my channel.